All right, so the first medical practice that I'm going to be going over that has been recorded to be done in African history is cataract removal. This medical procedure has historically been practiced by indigenous Africans in various parts of Africa, but for today, I'm sort of going to focus on a group of people in Nigeria, where a study was done on a couple of different people that had cataracts removed in the traditional indigenous way that people have done it in the past. The name of the procedure that is performed on people with cataracts is called couching. And this is a procedure that has been recorded as far back as 2700 BC in ancient Egypt. There are certain burial sites that have been excavated where copper needles that are used for the removal of cataracts have been found. And yeah, so this practice goes back in Africa a pretty long time. So what exactly is cataracts? So cataracts is an eye-related ailment that leads to vision loss as a result of the clouding up of the lens that sits in your eye. And it typically occurs in people as they become older, as they age, but it can also happen when you have some sort of a traumatic injury to your eye. The technique of cataract removal, the couching, involves the use of a very fine needle that is pushed into the eye at a certain angle. So it's pushed into the anterior chamber of the limbus and it dislodges the cloudy lens and it pushes it back into the vitreous fluid of the eye. And it removes it from the visual axis of the eye, which enables light to properly enter into the eye and get to your retina so you can see properly. And so this study that was done in 2013 and published in the Ghana Medical Journal on cataracts couching focused on studying a group of people that ranged between the ages of 60 and 90 that had had the procedure performed on them in previous years to see how well the procedure worked. So the sample size was about 20 eyes of people. And as I said before, they ranged between 60 and 90 years old. And so the place in Nigeria where the study was done was the Osogbo region, which is in southwestern Nigeria. And vision in the eyes where cataracts couching was performed, vision was maintained and was restored in 25% of the eyes for about 5 to 10 years. And in 20% of the eyes that were studied, vision was restored and maintained for a period between 2 to 5 years. And for about 15% of the eyes that were studied, vision was maintained and restored for a period ranging between 3 months and a year. So in all of the eyes that underwent couching, only about 5% of them had the low visibility maintenance period of a week, which is to say when they had the procedure done and regained vision, it only lasted for about a week. Of all the eyes that were studied, only about 5% reported that happening to them.